Dr. Nagesh, I really want to understand regarding your spine is a crucial element of the human body. Yeah. And this morning I was seeing an operation which was being performed by Dr. Amit. Yeah. Regarding the peculiarities and the integrities which have been involved in the neurosurgery. So I want to understand how complex or how precise is spine surgery with respect to orthopedic or cardiology or different disciplines. Just want to have your thoughts on that.
So, when we speak about spine surgery, it is one of the very intricate and complex surgeries because it's a bony canal within which you have the nerves. So the delicate structure is inside and the solid structure is outside, protecting the delicate nerves. And any misjudgment or an error can cause permanent damage to these nerves, resulting in, it can be as minimal as just some numbness, and it can be as severe as limbs are not working. He has got weakness of his legs or hands or all the four limbs, can have severe pain, can have incontinence of urine and not able to pass urine and motion. So the spectrum, any misjudgment or a miserror can cause a severe deficit from very minimal effect to a very severe deficit. So it's a very intricate organ of the body where a shell protecting it is just like a tortoise, you can imagine, with a hard shell, and inside you have the most delicate structure of the body.
Perfect. Since people who work in corporates or who do a desk job, we are always like into our screens. Yeah, always into our screens. This is the posture, which kind of a bent posture. So there was a hunch which has been developed over the time. So tell me, first of all, is it something we should be cautious about? First question. The second question, what should be done since we cannot ignore to work? Yes, so that's important. That computers all everywhere. What should be the right way to deal with screens and digital space, and how we can mitigate it?
So this part of the spine, this is called as work ergonomics, where the way you sit on your chair and how you work is very important. And because now most of the people, either they are working from home or they are doing a hybrid job, or they are sitting for long hours sitting on the table and working, has led to the appearance of spinal disease even in the young population. So we are now seeing spine diseases in the age group where it was not very common, and this is mainly related with the posture and poor nutrition and lack of exposure to the sunlight. These are the factors, and lack of physical activity also, and these are the factors which have contributed individually for the development of these problems. Now, regarding how do we prevent these complications, so the first thing is the work ergonomics, the way how you sit on your chair. So whenever you are sitting in your office on a chair, you should avoid sitting like this, which is called as slouching. You should not slouch on the chair. You should sit with the back portion completely against the back of the chair, and you should not keep anything in between. You don't need any pillow or anything. Cushion. Yeah, that's not required. You have to sit behind. So whenever you are putting a cushion and then doing like this, again you are slouching indirectly. So that is important. Second point is whenever you're getting up from the chair, you should not get up with a jerk like this. Okay, so first take your body weight on your arms and then stand up. Okay. Third thing is whenever you're working on a computer, the screen of the computer should be at the eye level so that you are sitting straight and working, and both the hands should be on the rest on the table when you're working on the keyboard, and you should avoid excessive bending and lifting heavy weights. And important thing is you should not continuously work for say 6 hours or 8 hours. You have to take a break after every 1 to 1.5 hours. Stretch your back muscles, hydrate yourself very well, and then come back and sit. So this is very important because it relaxes the muscles also from a particular posture. In one posture when you're sitting, the tone is set, so you have to change that and keep on changing your position after every 1 to 1.5 hours of continuous sitting. So this is regarding work ergonomics. Second thing I mentioned about nutrition, you have to take care of nutrition, especially take care of your vitamins like vitamin D3, vitamin B12, microvitamins, and vitamins and minerals. These are also equally important. If you are having a diet which does not have vitamin D3 or B12, it makes you susceptible for even a minor trauma, which can have sometimes really devastating complications. And third important thing that I mentioned was having a good diet which has high in protein. So you have to maintain a good amount of protein in your diet, which should be close to your body weight in grams. And the next important thing is doing certain exercises which are called as back or core strengthening exercises, which are very important because you are sitting continuously for very long hours. So your back muscles, if they are weak, then again you will have pain whenever you are sitting for prolonged hours. After 6 to 8 hours, when you go back home, you will feel extreme pain. So these are the things which are important if you want to have a spine which gives you a pain-free life for a very prolonged period.
Amazing. That's so beautifully articulated. Just want to wrap in and ask us your last question. You mentioned regarding the, like how we can, like take care of our posture, how to, sit right at the desk and all of that. But since if a person is under the influence of a bad posture, if he's like having the hunch, if he has developed that, he is not developing, rather he has developed that. So what's the set of basic activities or exercises or what he should do in a daily lifestyle to get to the original posture of how he goes?
Yes, so if he has already developed this, that is usually because of the muscle spasm or muscle or soft tissue related. There you definitely exercises like the back strengthening exercises will help, and isometric neck exercises will help. And always consult your physiotherapist. He will definitely help you in correction of your posture. The physiotherapist plays a very important role in correction of posture, and the exercises that they teach you, that has to be done sincerely, which will help in correction of this posture.
Amazing. One kind of like question which is more on the lighter note, which I have heard a lot, that people say normally old people, that you shouldn't crack your bones, like like do this and this and this, and also a few techniques have been invented, or rather I have just seen on YouTube where they chiropractic, or I even don't know the exact name. So it's been used to just crack the bones and make it relax and satisfy the patient. So is it really harmful? If yes, why? And if not, should we go for it?
So with regard to spine, though I'm not a chiropractor, or I have very little idea of this branch. What I can assure you is, for the neck, you should not get these done.
Okay.
Why? As you asked, why? Because you have the vertebral arteries which are going through the vertebral canal, and any inadvertent maneuver can cause dissection in these vertebral arteries with complications resulting in stroke. So you have to take care of your neck. That is the very delicate organ, and your spine of the neck, you should not get it manipulated by any means. We have seen patients where they have gone for a massage where they have manipulated the neck, and they have ended up in emergency with a stroke. So, for neck, I can let you know. But regarding the other things, that's not my field.
Yeah. So it's better to keep it aside for people.
Yeah, I have no idea, so I would not comment on.
Perfect. So thank you, Dr. Nagesh. It was amazing talking to you, and I got a lot of insights regarding the spine and the bone and the posture and what are the methods. So it's really great to talking with you. Thank you. Appreciate it. Thank you.
The pleasure is mine.
Thank you.